In the U.S., we try to combat poverty by providing more money, either directly or indirectly, to households that qualify for various federal and state programs. I walk through the definition of, the official definition of poverty in the U.S. Again, there's a lot of criticisms of the measure, and because of that, there's not a lot of consensus among voters and politicians about how to define poverty and how to define actual need. That said, there does seem to be some general agreement that no matter what we define need as, we should be providing help to people who need it. Inequality, though, in and of itself, is not always viewed as a problem by everyone. Some would argue that in a capitalist system, inequality is simply the product of competition. Some folks might be content to live with some level of inequality. Other folks view it as a problem, and some view it as a problem, but only when it reaches a certain level. From a policy standpoint, since its inception, the federal income tax and other tax policies have been used as a way to deal with income inequality, although perhaps in a more subtle way. In the U.S., those who have lower incomes are taxed at lower rates, while those who have higher incomes are subjected to higher rates of taxes. This ends up having the effect of redistributing income to some extent, so that those with lower incomes get to keep more of what they earn, while those with higher incomes keep less. Historically, though, in the U.S., when tax rates paid by those with higher income have been high, and at one point the highest tax rate in our country was 90%, at those points in time, income inequality has been at its lowest. The reverse is true as well. When those with higher incomes pay lower tax rates, income inequality tends to be much larger. But let's talk a little bit more about anti-poverty programs, since these are ones that are much more well-developed. As we noted earlier, we provide cash and in-kind programs to help households make their basic needs. What I mean by in-kind is we have programs that instead of giving cash directly to households, give them something that they can use like cash. So an example of this would be the Supplemental Nutrition Assistance Program, SNAP, which most people know by its more informal name of food stamps. Families get an electronic benefits card. They can use it at grocery stores to buy groceries, but they can only buy food with it. You can't buy other products. You can't pay your light bill with it. Other families might get housing assistance. That is, they have a voucher that helps them pay for their rent. It can only be used for housing. It can't be used for anything else. So those are just two examples of in-kind programs. There's a whole host of debates about how we provide assistance to families, whether it be via cash or whether it be an in-kind kind of benefit program. I'm going to highlight some of these debates in the U.S. just so you can get a flavor of them. So one of the things that policymakers often worry about are about the incentives and disincentives that might be embedded within some of these behaviors. So at various points in time, policymakers have been more or less worried about the existence of safety net programs as serving as a disincentive to work. That is, if there is a program that provides cash to people with very low incomes, if we give them cash, will that then mean that they won't have the incentive to go out and work? The research evidence as on this question is somewhat mixed. It is important to note that all of the public benefit programs in the United States provide fairly modest to quite low levels of benefits. If you are a family, a mother with 2 children, for example, who lives in one of the southern states and you have no income at all, you might only be eligible for about $170 to $190 a month in cash benefits. So we're not talking about programs that are generous, by any means, but political conversations often entailed debates about whether or not social programs are disincentivizing employment or other types of behavior. Another incentive that folks worry about, at least in the policy arena, is whether or not benefit programs should be available to everyone whenever they need them, or whether or not there should be some limits upon their receipt. Currently, our food stamp program, whenever your income falls below an eligibility threshold and you meet other eligibility criteria, you can receive benefits from the food stamp program. Our cash welfare program in this country, which is called Temporary Assistance to Needy Families, does not work like that, though. Families who are eligible to receive this program may do so, but there is a federal time limit of 60 months, which is roughly the equivalent of 5 years. So after 5 years of receiving benefits from this program, a family may no longer be eligible to receive that. And the idea behind this is, that again, we want to incentivize a certain kind of behavior. In this case, policymakers might argue that they're incentivizing work and self-sufficiency and not relying on government benefits. Again, I'm talking about these in terms that policymakers use. As budding social workers, you should think about what the Social Work Code of Ethics might have to say about some of these debates. The other debate that is sort of a perennial one is the degree to which state and local levels offices and programs should have a lot of flexibility in running safety net programs versus how much control the federal government should have. There are discussions right now about giving states what are called a block grant of money to run a health care program for low-income folks called Medicaid. This would give states a lot of ability to make their own rules. People who believe in state and local level flexibility might argue that states know the particular situations of their own populations the best, and they should be allowed to experiment and do what they need to do to serve their citizens best. On the other hand, people who support more federal control might say that, in order to make sure that there is equitable treatment of all U.S. citizens who receive services, that there should be more federal control. There also are some issues when we think about a block grant funding mechanism, which is a fixed amount of money that could run out, versus a federal program that might be one where funding is guaranteed. Just very briefly, I want to talk about the 1996 welfare reform as a case study in these sorts of debates. So previously, before 1996, we had a cash welfare program called Aid to Families with Dependent Children, or AFDC. This is a program that was part of the Social Security Act. It provided cash benefits to primarily single mothers, single fathers also, but served primarily single mothers and their children who had very, very low income. The program had income eligibility requirements, but other than that, a family could remain eligible if their income was very low up until the youngest child turned 18. In the 80s and 90s, the policymakers began to have discussions worrying about some of the incentives that were possibly embedded within these programs. Some people argued that this had become an open-ended way of giving assistance, that women were choosing to rely on welfare benefits rather than go to work, that they were staying on welfare for extended periods of time, and in fact supporting their families on the federal government's dime. And there was also some arguments being pushed up from several governors, that the federal government really wasn't the best entity to run these programs, that really states, again, knew best and should be allowed to experiment. There was a lot of traction. I'm not going to go into the details of the entire political debate. Congress debated this issue for years. In the end, a welfare reform bill was passed in 1996 that did a number of things. It replaced the Aid to Families with Dependent Children program with the Temporary Assistance to Needy Families program. And as the name of the new program implies, it is indeed temporary. As I mentioned before, it has a time limit. Families are only able to receive benefits, cash benefits from this program for up to 5 years. And in some states, if the state decides it wants to have a lower time limit, it can do that. The program also has work requirements in that. So in order to receive the assistance, an adult recipient must be looking for a job or be employed or be doing something that is intended to move them into the labor market. And finally, instead of being a program that anyone who was eligible for it was able to receive a benefit, what's called an entitlement program, the funding for the program was transformed into a block grant. So states get a set amount of money to run the program. When that money's gone, it's gone. So states have been very cautious about how they spend money, and there is some evidence, and you can read Luke Schaefer's $2 a day, that some states have really restricted access to this program. But this is, I think, a good example, or a startling example, depending on how you view these things, is the ways in which concerns about incentives and concerns about who gets to control a program play out in a very real way and affect families who are trying to receive assistance. Finally, I want to end by talking about the Earned Income Tax Credit, or the EITC as it's called. The EITC represents a really kind of interesting combination of both traditional anti-poverty policies, tax policies, but also takes into account some of these concerns about incentives that are embedded in our social welfare programs. So the EITC is designed to provide cash, although cash in the form of an income tax refund, to qualifying families who have low and moderate earnings. So in order to receive the benefit, you have to have worked at least some during the year and earned money from that work. And again, this reflects some of the concerns that policymakers have had about work and incentivizing work in our social policies. The amount of money received through the EITC increases the more that the qualifying family earns. So if you look at the graph, this is that blue line that slopes upward and is called sort of the phase-in portion of the Earned Income Credit. The amount of the credit is capped. In 2017, a household with one child could receive no more than $3,400 from the EITC. And at a certain level of earnings, the credit begins to phase out. That is, for every additional dollar earned, the credit is reduced by some amount. And then eligibility for the credit also ends entirely. So in 2017, for example, a married couple with one child would be ineligible for any EITC credit if their income was above $45,207. All of these thresholds are available in the Internal Revenue Service's website. And again, this too reflects a concern about sort of dependency on social welfare programs. Policymakers didn't want to, they wanted to both incentivize work, but they also didn't want to create another program that looked like it was just government assistance for everybody. Despite the very significant limitation that the EITC is only available to those who have earnings, it currently is serving as the nation's largest anti-poverty program. It also does function as a way to redistribute income, so it is functioning too as a way to deal with sort of the large levels of income inequality in this country today. That's a very brief skimming through of some of our social welfare policies in the United States and the Earned Income Tax Credit. I would urge those of you who are interested in learning more to visit websites of the federal government that are in charge of running various programs, and to look at the documents that are put out by policy advocacy organizations so that you can see the different ways in which advocates and those who are critics of these programs frame the issues. Thank you.